Children and cancer. Two words a parent never wants to hear in the same sentence. Yet, approximately 160,000 children are diagnosed with cancer every year. And sadly, survival depends on where you live. In developing countries, at least 80% of children with cancer die because of lack of treatment. In the United States, 80% survive. We have the cure. They don't.
If your child is diagnosed with cancer and you live in the United States, there's an excellent chance that your child will survive. But if you live in a developing country and your child is diagnosed with cancer, that diagnosis of cancer is the same thing as a death sentence.
Keira Grace Foundation addresses a major overlooked health tragedy by delivering proven cancer treatment to children in developing countries.
By delivering proven cancer treatments that we have here in the United States, we can increase survival rates by more than 400% in developing countries, and we can do it for a fraction of the cost.
For the same cost of treating one pediatric cancer patient in the United States, 10 children can be treated in a developing nation.
Treating cancer is very complicated and dangerous. If the medical team doesn't have the right tools, training, or consultation from cancer specialists, then their best efforts may be in vain.
Keira Grace Foundation creates a collaboration between U.S. oncologists and medical teams in developing nations, while supporting 4 key areas of cancer treatment: staffing, training, infrastructure, and consultation.
When we first started working in these countries, doctors were forced to take a second job just to make ends meet, and that left very little time for our patients. Nurses were losing their hair because of improper handling of chemotherapy agents. And overall, there was a lack of infrastructure, and more importantly, a lack of access to expert consultation, which is critical in taking care of these patients. By supporting medical teams in these key areas, we're seeing dramatic shifts in cure rates.
Keira Grace Foundation is saving lives and is a good ending to a story that had a tragic beginning.
My wife Eileen and I know personally what it's like to have a child diagnosed with cancer. In 2003, both of our children were simultaneously diagnosed with cancer. Our son survived, but our daughter, Keira, did not. We know the pain of losing a child to cancer, but we also know about the hope that comes with a cure. And it's that experience that brought us to the point where we wanted to make a big impact for those kids that had absolutely no hope.
The good news is that the treatment of children's cancer has improved dramatically over the past 30 years. So in our country, we have the cure at hand.
By sharing the cure, Keira Grace Foundation brings hope, restoration, and life to children with cancer in developing countries. Will you help us fulfill Keira's legacy?
Please share the cure.
You're beautiful. You're beautiful. You're beautiful.